In the Individuals with Disabilities Act of 2004, cancer is considered under the Other Health Impairment category. Other health impairment means having limited strength, vitality, or alertness to environmental stimuli that results in limited alertness with respect to the educational environment that is due to chronic or acute health problems, which include cancer, and adversely affect a child's educational experience. The New Jersey Special Education Code says other health impaired corresponds to chronically ill and means a disability characterized by having limited strength, vitality, or alertness, including a heightened alertness with respect to educational environment due to chronic or acute health problems such as attention deficit disorder or attention deficit hyperactivity disorder, a heart condition, tuberculosis, rheumatic fever, nephritis, asthma, sickle cell anemia, hemophilia, epilepsy, lead poisoning, leukemia, diabetes, or any other medical condition, such as Tourette syndrome, that adversely affects a student's educational performance. A medical assessment documenting the health problem is required. Cancer is a common name for hundreds of diseases caused by abnormal cell growth and division. Although normal human cells can grow and divide at a safe and steady rate, cancer cells have the ability to grow and divide at alarming rates around organs, bones, and various tissues of the body. When these cells continue to grow and spread, they can form tumors on important functioning sites inside the body. In adults, cancer can take years to form and be detectable. Childhood cancer differs because the time period for cells to form a cancerous tumor is much shorter, allowing the disease to advance dangerously fast. A student with cancer can be any type of student. They could be advanced, average, or below average students and can even have disabilities present prior to being diagnosed with cancer. However, cognitive issues can take a toll on a student if cancer is present in the brain, as well as after treatments and therapies are conducted to fight the disease. The powerful chemo and radiation therapies increase likelihood for memory and learning disabilities. Treatments can cause damage to hearing or vision, physical disabilities, and damage to the central nervous system, all of which can result in learning disadvantages. Problems that arise after cancer treatments in children can be essentially in any academic area, such as reading, spelling, math, concentration, attention span, memory, organization, problem solving, processing, and social skills. Prolonged absence from school will make it harder for a cancer patient to work at and develop new friendships with their peers and classmates. Not having daily access to conversation with children of the same age could possibly affect how the child will perform socially in the future when they return to school. Cancer patients also have experiences that other students will not be able to relate to, and vice versa. When a student returns to school from being gone for an extended period, it can be helpful if a teacher assists them in their re-socialization and acclimation to the class. Emotionally, children with cancer can be on completely different levels than students who have not experienced cancer. Emotional scarring can occur because of the vicious treatments and surgeries that cancer patients endure. Physical differences between cancer patients and healthy children can cause a decreased self-worth in a student with an abnormality. When students who look different than everyone else are teased, bullied, and taunted, emotional damage will occur like in any bullying instance. Children who have permanent scarring from cancer are self-conscious and constantly have to face the comments and stares of people who do not understand the circumstances. Physical development differs in all cases of cancer. Different types of cancer will constitute for differences in physical changes. Cancer can cause tumors on any part of the body and can be large and visible or outwardly undetectable. Surgeries to remove cancerous tumors are typically what cause tangible physical abnormalities. Since a tumor can happen anywhere, all surfaces of the body could be at risk for looking different depending on the type of cancer. Other physical changes are prominent in cancer patients as well, including hair loss, loss of energy, weight gain or loss, mood swings, facial fullness, problems with coordination, difficulties with fine and gross motor control, muscle weakness, and body marks resembling tattoos, which identify sites of radiation. Any of these physical changes can call for the use of a wheelchair or other accommodations that will maximize the ability to move around and feel as normal as possible. Challenges associated with cancer are reflected by the outcome of treatments as well as any difficulties physically, socially, or emotionally. First of all, cancer patients are faced with the challenge of having to endure the brutal treatments that represent their only possibility at living. After treatments, numerous changes can present additional challenges to a child who suffers from cancer. Having physical differences can cause emotional disorders like depression, which is an entirely separate disorder that needs to be dealt with on its own terms. Students with cancer also have to struggle with constantly being removed from their classroom and friends, which can lead to not being able to maintain relationships. Academically, missing a lot of school can cause cancer patients to fall far behind, even with homeschool intercession. Having to complete schooling without classmates and the experiences associated with a classroom can affect the learning experience of a student. Not having access to ideas and opinions of other students could hinder a child's ability to expand their own mind. The strengths that come with cancer have to do with the experience of having cancer. Cancer patients have a better outlook on life because they are more grateful to live and are definitely more thankful for everything they encounter. Having a thankful attitude can enhance life in countless ways. Simple experiences and interactions can mean so much to someone who was or is familiar with the idea of death. The Children's Oncology Group says, overall, most children's cancer survivors have a good quality of life and sense of well-being. After treatment, looking back on these experiences can challenge the way children, teens, and their families think about themselves and their world. Many people begin to see positive changes as a result of surviving the cancer experience. They feel stronger. Cancer survivors have a better ability to realize what is important in life and are better able to handle difficult situations because of their experiences. Working together with the child's oncology team and the school nurse to learn how to properly monitor a student with cancer in the classroom is something that a teacher should do prior to having a student with cancer in the classroom. Since teachers are with students most of the day, it is necessary that they can identify medical issues that can occur with cancer, such as fevers, bruising, nosebleeds, and swelling. If the child has any surgery sites or intravenous care that they require in the classroom, teachers also need to be able to identify when the student may need assistance. When cancer patients have extended absences, it is still important that the student feels included in the class. Teachers will have to make an effort to communicate with the student while he or she is out. Having students in the class communicate with their classmate is also important. Sending letters and cards to the student in the hospital will allow them to keep in touch with classmates. Email and social networks can also allow a cancer patient to interact with the class virtually. Having online assignments will make a cancer patient feel as if they are being included in the work the class is doing. Technology is such a great way for teachers to communicate with students who do not presently have access to schooling. Today, we are no longer limited to sending videos to a hospitalized student because webcams allow for real-time chats between people that are in entirely different places. Informing students about what a student with cancer has experienced is a good way to help the student re-enter the classroom when the time comes. Teachers can even include the student with cancer in educating the class about the disease by allowing him or her to give a presentation if comfortable. Teachers should note what cancer is and what the treatments are to stop cancer from spreading. Also, teachers need to answer questions regarding the disease and the myths that could be associated with it in the minds of children. Since it is always a teacher's job to try to encourage friendships among their students, it is also necessary that the teacher encourage social support in respect to the child with cancer. Teachers need to make sure the class understands why a student might look different, but that any difference should not mean the student should be treated differently.